I've learned how to teach psychodrama online since COVID began. It has been thought that this is a very much of an in-person process. But out of necessity, I have learned that you can do psychodrama very successfully virtually. I've worked out a way that you can do psychodrama one-to-one, and also it's home-based, which is group therapy. So one of the issues in treating trauma is that if you use psychodrama, which is so important as an embodied experiential method, it can go all over the place. It can lack a who, what, where, and when. Psychodrama and sociometry help to pull that into focus. What I've developed, I call relational trauma repair sociometrics, and that is essentially a protocol for incorporating experiential bodied work into your practice with greater ease and focus. It doesn't require the kind of in-depth training that psychodrama requires because I don't include the doing of big psychodramas. There is so much that can be done through simple role plays, empty chair, think Gestalt therapy, and using techniques such as role reversal and one-to-one that are some of the core brilliance of psychodrama, which was developed by J.L. Moreno in turn of the century Vienna. It is a group method. Moreno is known as the father of group psychotherapy. He developed psychodrama because he saw that children play roles in healing. They play roles in working out the conflicts of their lives, and then they reverse roles to experience both sides of a dynamic. If you think about trauma, if you think about object relationships and internalizing people or roles, what we really internalize is the dyadic relationship or the constellation of relationships. And that's what we're untangling in working through adult relational trauma. Words alone, says Bessel van der Kolk, do not treat trauma. We need to bring in the body, Peter Levine. We need to talk to the various parts within us, Dick Schwartz, inner parts work. And we need to be able to bring the nervous system, Steve Porges's work, into working with trauma. I have found incorporating these methods and this kind of theory into psychodrama and sociometry has given me a way to target work that was not available to me when I was using theoretical basis of, say, only psychoanalysis or object relationships. We need to really understand what's going on in the body because feeling shows up in the body first. And especially if you're engaged in a role play, which is a role relationship, what happened in that role gets stimulated by simply saying, who can play your mother and what do you want to say to her? Suddenly you're in that moment, in that relationship, and your body as well as your thinking are there. We have to feel in order to heal trauma, not learn to tell a better story of what happened to us, but be able to feel it through and process it. Oftentimes I see that people learn how to work on their trauma with words, but they don't work through it. How do you know that? Because when you're triggered, you get stuck in the reliving and you cannot find your way out. We need to be able to have specific vehicles that bring emotional literacy. How does that happen? It happens because somehow the feeling is stimulated and felt. Remember, with trauma, the feelings tend to be hidden and thrown out of consciousness. So the healing in its simplest form is learning to tolerate bringing them back into consciousness, learning to tolerate our body responses. So once we feel the feeling, name it, translating it into words, sharing it with another person, and then listening as other people share without exploding, imploding. That is the foundation of being able to develop new relationships.